I'm Carl Hill with the Alzheimers Association. Really excited to be here. What I think, interesting discussion. I'm hoping we can get back to that, so I won't take too much time. I lead diversity, equity, and inclusion with the association, so as you would imagine, we're really interested in this issue of access, equitable access and recruitment, and we certainly advocate for access to these treatments, but we want to know why, they can't be more representative of the people who are disproportionately affected. And so I was going to do a whole thing about community. I come from an example of how people came together to really tackle an issue. This was the lack of African Americans who were trained in public health way back in '95. That's me in the back hiding. Bill Jenkins was the first whistleblower on the Tuskegee syphilis study. Dan Blumenthal, white male. The point here is that it takes the community to come together, including the pharmaceutical industry, I think, which I think is great to have representatives here talking about what we believe to be the solution to some of these issues. Alzheimer's Association, just global organization, advancing support, care and research. Cheryl, my colleague who leads our chapter here, and Cheryl, please raise your hand. Leads our chapter here in the New Jersey area. So our goal is to get research findings and resources to people who need it. And that makes us I think a public health organization, and right in line in some of this work. I was going to spend some time talking about how I think DEI is fundamental. I don't know if I have to make the case with this group, but equity is the thing, right? Equity is, sometimes doing something a little more and sometimes something different. For example, in the case that we just discussed about, recruiting people into these trials. Certainly we certainly believe that these treatments should be covered by CMS. If you've been following the news, they're FDA approved, and it's an exciting time for Alzheimer's research. So all people should have access. But as was discussed earlier, we just don't know if they're safe and effective in all people. And, one of the interesting questions was, how to, all this stuff sounds good, but how do you not think about this from the beginning, in designing the trial, and how internally, can we get researchers, government-funded researchers with pharmaceutical, companies to think about representation as their own benchmark before they move forward and submit to FDA for approval. Some of this data was also shown. I'll tell you this really interesting special report on race, ethnicity, and Alzheimer's. So, putting it in context, what are some of the factors that cause African Americans to be 2 times more likely to have Alzheimer's or another dementia? And I say another dementia because Alzheimer's is the most common cause, but there are other types of dementia, like vascular dementia. Mixed dementia is prevalent, so researchers have to really study the different types of dementia. What's good for the heart is good for the brain. All this is really important to really understand the disparity that we see. And so this data was, some of this data was presented, but we found some really interesting findings. I kind of go through the genetic, going through the agenda, you had, Dr. Goldie Bird and Dr. William Hugh talking a little bit about the genetic contribution, so that's already there. This is the individual level kind of health behavior, where we see that getting people's hypertension in order showed a decline in mild cognitive impairment. Dr. Israel showed this progress between MCI and Alzheimer's and dementia, so that's the individual level. We're studying some of this individual level factor stuff, the recipe between physical activity, nutrition, and cognitive stimulation with the USPointer Trial. So be on the lookout. We're done recruiting with that, and we have 30% underrepresented populations in that trial, so that we're going to be able to study this among the people who are more likely to have Alzheimer's or dementia, African Americans. That's just logical. Social class matters here, so it's not just genetic or individual. individual level is something around access to resources, access to these FDA-approved treatments, access to care, really important. There's some research that continues to show that social class matter. I always talk about this, while education is a part of social class, it's not as protective for all people, right? And so I use heart disease death rates as an example to link to vascular dementia. Many of the risk factors are the same. But here, the ratio for when comparing black men and women, it increases with years of education. Maybe something's wrong with our education measure, or maybe it's just not as protective for African Americans as we think. That links into W.E.B. Du Bois, who I think is the founder of, or his concepts, his theories are really really drive health disparities research. It's something about stress, right? So something there. We found this in the special report. More than one-third of black Americans believe that discrimination would be a barrier to receiving Alzheimer's care. That's critical because these treatments are for people who are diagnosed at the mild cognitive impairment phase, right? And so you've got to know about the treatment. You've got to know this great video that you showed. It was wonderful about people just understanding Alzheimer's and dementia. I give these talks, people asking, what is the difference between Alzheimer's and dementia? That means that we got to be out there having that discussion, but we have to also talk to people about what the label says for these treatments, and if they feel like they would be treated unfairly because of their race or ethnicity, they're less likely to go. Half of black Americans report actually experiencing, nearly 2/3 of black Americans believe that medical research is biased against people of color. So again, when we're out in communities, we talk about, the numbers of people who are recruited, like you said, not just participate, but are recruited to participate in these trials. We just don't think it's for us, right? And so this inclusion is so important. I'm just kind of running through this real quick. At the Alzheimer's Association, from a diversity, equity, and inclusion perspective, we're really, hoping to promote more multi-level health disparities research. We have a very rigorous medical and scientific team and an international research grants program, more representation in health systems that was discussed, but it's pipeline, because as my brother said on the last panel, it's just not enough neurologists and dementia specialists to go around. So we've got to start connecting with HBCUs and high schools to let them know about these careers and the justice component in these careers, right? Not just that you can get paid, but, our communities, our families need to feel like they belong when they go seek dementia care. More cultural competence and humility among, the white people and the other racial ethnic groups that provide care. Everyone needs to have to have a certain standard of delivering care and making people feel like they belong. And then we're partnering, just like, my colleague said earlier, with organizations really seeking to enhance trust so that we can get resources out to the community. We've got a wonderful chapter here in New Jersey, one of 74 chapters around the country. We don't run any clinical trials. The USPointer Trial is one that we collaborate with other people. So our work is to get resources about what Alzheimer's and dementia is, and support for caregivers, and all the stuff that people want to know about Alzheimer's and dementia. Our chapters are still physically in community doing that work. Cheryl's leading that work for us here in New Jersey. And so, we look for opportunities to collaborate with pharmaceutical companies, but then we're always perceived or critiqued for maybe working too closely together. But we've got to work together because the pharmaceutical companies are the main ones running the trials. Of all the people doing the trials, it's the researchers at the pharmaceutical companies, right? So we have to find a way to really work together to create trust. We've got all these people that we work with, these organizations. They're great organizations. It means nothing if we're not able to activate locally, right? So we've got to move from a logo on a slide to, the pharmaceutical companies working with Cheryl, working with Omega Psi Phi fraternity, my fraternity, or the National Black Nurses Association locally here in New Jersey. These are the things that have to happen, for us to, and it's not a quick or easy process. As establishing trust means we've got to show ourselves to be trustworthy. It takes time. We work with the African Methodist Episcopal Church. it has taken us over 5 years for them to just simply share contacts of their clergy in regions around the country. You know, we've been meeting, what do you want to do? You want to take this out here and share this with the community? No, you're not, because it doesn't look like us. It doesn't look like anybody from our organization, is here. We have to create all new content for us to use. That takes time, right? So it's great to put this up and, put this up and say we're using a community-based participatory research. The theory matters, publish the paper, present at an international research conference. The work is getting out here and showing yourself to be trustworthy. That takes time, and sometimes it takes, acknowledging that some things have gone wrong in the past, right? And so, but this partnership is starting to move on because we've been able to have 3 Purple Sundays where all the AME churches, this is the largest black church in the United States. So they all have some component of Alzheimer's and dementia awareness, and then we have a webinar on the same day. This year we had 8,000 attendees around the country. Maxine Waters was a politician, a representative who spoke during that webinar. So we're making some progress, but it takes time. I collaborate with my brother here, Dr. Robert Turner, on a brain health, men's brain health annual conference and training program for emerging scholars just before the Super Bowl every year. This is a chance for us to use the Super Bowl. We're ex-football players, Robert and I. He much better than I. I was, but using that as a stake to say, come out and learn about Alzheimer's and dementia in the host community, host city of the Super Bowl. So we've been doing this a couple years, and I think this, again, an opportunity to show partnership and how that matters. And then, I trained as a researcher and all this kind of stuff, published papers. I never thought I'd be an executive producer of a stage play. So we partnered with Gary Davis Productions to put together a play where we're touring the country, getting in communities, again, talking about the importance of participating in clinical trials and what Alzheimer's and dementia is, what the Alzheimer's Association is, right? We love to partner with pharmaceutical companies to get people out and so they can learn about trials that they could potentially participate in, right? And so just thinking of ways to make sure that if we develop a treatment, and treatment here is not just the drugs, it's a lifestyle intervention, it's information, it's a combination of things. Many people, this number continues to rise as time goes on, but many people who are expected to develop the disease in 2050 would not, right? And so as I end here, we've got to really, throw ourselves down on equity. Equality matters. We want to make sure everyone has an equal opportunity, equal chance at the treatment. But you can't get to equality unless you pass through equity. And equity is understanding what people need. And sometimes that's a little more. It's a little more, spending more resources to make sure that the people who are disproportionately affected are invited or included. And sometimes it's a little different, like the stage play. That's not classic health education, but it's edutainment in some communities, which resonates a little better than somebody like me standing up, giving a lecture, So these are our call to actions. You've seen that, and I always end here, but we started in a place of diversity, equity, and inclusion, and we've got to continue that legacy so that we can have more representation. Now in there. Thank you.